I'm so ready to see people's face. I'm ready for COVID to go away.
Today marks 2 years since the first COVID case was recorded in the United States. So much changed so fast, from the virus itself to how we treat COVID patients. Certainly vaccines play a huge role in the fight. And just today, the CDC talked about how much boosters help in the fight against Omicron. Well, tonight, we want to get an update from the front lines. 12 News reporter Amelia White is live at Baptist Hospital. Amelia, what are you hearing from doctors?
Jordan, 2 years since our first confirmed case. Since then, we've seen over 69 million cases, plus 864,000 deaths reported in the U.S. Tonight, we're hearing from one local doctor on his perspective on where we once were to now. It's been 2 years since the first case of COVID-19 was detected in the United States. Since then, a lot has changed.
We have totally changed, and the virus has changed as well.
From health officials' perspective, like Dr. Ray Callis, they were introduced to COVID-19 with little to no resources.
I will tell you that what's changed dramatically is that we do have supplies now. We do have needs of, or we do have treatment needs that we can utilize. We know that there's drugs that can treat it. We know that there's vaccines that treat it.
Even their approach to nurturing folks back to health changed. Now they're not finding a ton of people on ventilators how they once did.
We were putting people on multiple different ventilators, connecting them to one oxygen source in order to try to keep them alive. And that was 2 years ago.
As for the virus itself and all of its variants, Dr. Callis says the length of time someone is sick looks different today.
We're seeing a decreased length of time that this virus is staying active in each human being. You remember before, we used to be 14 days at a minimum quarantine. Now we're down to 5.
Even with 2 years down, there is still a long road ahead.
Coronavirus is not going away, but I think that as days go by, the more and more treatments we have, the better chance we have of going back to a normal life.
Dr. Callis says it's important to keep those daily COVID-19 practices in play. Wear your mask, social distance, and get your shot of hope. I'm live in Beaumont. Amelia White, 12 News.